Yeah, so let's get started. My name is Amit Sawant. I'm the Chief Product and Business Officer at a health tech startup called Somatix, where I lead the product and business strategy for the company. Um, and let me talk a little bit about my background. So my background prior to coming to Somatix was more so on the high tech side. I've been working at companies such as Dell Technologies, Riverbed Technology, NetApp, where I was the head of product management. So sort of worked on products as to how do you conceptualize the products, what are the requirements, how is it that you work upon those requirements, what is that the market is looking for, what is it that the competition is doing, and then working with engineering to build those products and launch those products in the market. And also, I have a PhD in computer science, specifically in data analytics and visualization. So, artificial intelligence, machine learning, predictive analytics, all of these are sort of something that I really enjoy. So, therefore, I got this opportunity early this year to be part of the health tech industry with Somatix to come in and how is it that we can commercialize uh, the technology that we have built at Somatix, which is about AI powered remote patient monitoring. So here's make sure I can advance the slides. Okay, here's sort of the outline of the next 35 minutes or so. I'll talk a little bit about the motivation around remote patient monitoring, sort of what are the building blocks, sort of basically answer the why aspect of things. Then I'll talk about it. How is it that we at Somatix, with our AI-powered platform, address the why of remote patient monitoring? So sort of that encompasses the what, and then I'll give a bit of a demo of the product as well, a live demo, and sort of which will address the how aspect of things. And then I'll finally summarize with what are the key takeaways that the audience can take home. Okay, so let's get started. So let's talk about the why. So before launching our product or before working on any of the aspects around remote patient monitoring, we sort of did some market research, trying to identify what is the need in this area. So some of the data points that we gathered are listed on this slide. By 2035, we expect that the seniors, that is folks above 65 years or so, will outnumber the children in the US for the first time. So that's something that you can attribute towards increased quality of living, improvement in the quality of living, and things of that nature, right? And then we also expect that 86% of seniors want to stay in their homes rather than go to like elder age communities or be in nursing facilities or so. They want to be independent. Then how is it that we can enable that? Then we also saw that about 33% of adults above the age of 65 suffer from a fall each year. So how is it that you can, first of all, avoid that, and if possible, like further reduce that? So that's something that we try to address with our remote patient monitoring solutions. So here are some additional data points as to why is the US market in need for such a type of monitoring solution. About 1 in 4 people with high risk patients such as CHF or COPD are readmitted into the hospitals. And if the patient is readmitted within 30 days, the hospitals typically have to shell out $15,000 per patient. So that's a big cost for the hospitals to incur. So how is it that you can avoid that? That is first making sure that before a patient is sent home, they're sent home with like make sure that their condition is good enough for them to go home. So that was one aspect. Then we also saw that about 10,000 people in the US are turning 65 every day. So that's a big number, as we saw in the previous slide as well. 1 in 3 suffer from falls each year. 1 in 5 Medicare patients are readmitted within 30 days. So these are some big numbers that sort of gravitate towards the main point that we need to have some sort of a monitoring solution for these elderly folks. So now let me talk a little bit about how is it that we try to address these challenges. So Somatix is the provider of AI-powered remote patient monitoring platform that uses wearable-enabled gesture-based detection technology to provide clinical insights to improve patients' outcomes. So sort of our mission is to improve patients' lives using technology in a cost-effective manner. Then some of the use cases that we work on are people in the elderly care facilities across hospitals, which is the discharged patients, rehab centers, nursing facilities, and so on. So here's a little bit about our platform. So we track users' activities of daily living using novel gesture-based detection from a wrist-based wearables. So something that you can see on my hand here. And we monitor these data points 24/7 in a very passive manner on a patient using these wearable devices. So that's you can imagine that you are collecting a whole lot of data. That is, we are collecting 500,000 data points per patient per day. So that's a big number, big amount of data that we are collecting. And then we collect this data to identify trends, patterns, and then we also do AI/ML predictive analytics on top of that data to provide clinical insights that can be used by the healthcare providers, that is the physicians, the caretakers of these patients, to take better care of them. So what is it that the platform comprises of? It comprises of the caregiver dashboard, which you see here on the screen on the right-hand side in the image. Then we also have a user app that is a patient can monitor themselves by just looking at their, okay, yeah, here are the number of steps, the amount of sleep, the quality of sleep, how much liquid intake did they have on a day, so on. And similarly, we have caretaker apps because these physicians, nurses, caretakers are always on the go. So you cannot expect them to be sitting at their workstation and just looking at the patient's data. But can they have an app either on their phone or on their tablet so that as they are on the go, if there are certain emergencies, notifications, they can receive it on their apps, on the phone, or the tablet that they're using. And then the final piece is the smart band. So here's a smart band that I showed, but our platform, our software also works on any of the commercially available smart bands out in the market. Okay, so what are the things that we monitor? So this slide talks about those things. We monitor walking, the number of steps, the quantity of sleep, but also the quality of sleep as well. We use something called as Pittsburgh Sleep Index, which calibrates the quality of your sleep from 0 to 100%. And then you can monitor that, you can trend that across days, and then identify whether a person's sleep is improving or deteriorating. Then fall, we can also detect falls. So some of our competitors can only do forward fall, but we can also not only do forward fall, but backward fall, sideways fall as well. If somebody is in a wheelchair, we can also identify whether the person fell from the wheelchair or not. Then one of our biggest competitive advantages is drinking. We can not only detect the drinking, but also the amount of liquid that the person intook. That's down to the accuracy level of milliliter, not only cups, but down to the accuracy of milliliters. How many milliliters of liquid did the person have. And you can imagine that if you were to trend that across multiple days, like you can identify whether a person is veering off from their baseline, whether it's a person at a risk of dehydration. So we can monitor that and notify that as well. Then medication intake. We can not only send reminders to patients to take their medication, but we can also track whether they took the medication or not. That is, you're wearing the smart band, you take a tablet in your hand, you put the tablet in your mouth, then you drink the water. So these sequence of steps, which is calibrated using our wearables, these gestures, they identify that a person did take the medication or not. Similarly, for all of the other things that I talked about, whether drinking, walking, sleeping, right? And smoking. In fact, we started the company with building a product for smoking cessation. So we can not only identify the number of cigarettes, but we can also identify down to the accuracy of how many puffs did a person take. Then emergency button. So the only thing, active thing on the smart band that we have built, our purpose-based smart band, is the emergency button. So that if a person is at some sort of a risk, they can just press the emergency button and that can send an alert or notification to their caretaker, right? Then in our next generation product, which will smart band, which will come out by the end of this year, we will also have optic sensors on our smart bands, which will measure heart rate, blood oxygen saturation as well. So after collecting all of this data 24/7, we can also do predictive analytics on that data. So we can do UTI risk analysis, pressure sore risk analysis, the readmission risk and fall risk analysis as well. So what's the biggest advantage of having this sort of a remote patient monitoring solution is that you don't need to have any beamers, any sensors installed where the patient is, whether at a nursing home facility or at their house or at the hospitals. It just purely works based on the risk-based smart band. We collect the data 24/7. That's it. No additional hardware installation or maintenance is required. So you can imagine it not only works indoors, but it also works outdoors. Okay. So what is it that our solution incorporates? Okay, so I talked about the dashboard, the smart band, the apps, but we can also integrate with third-party devices. Because typically at a nursing facility or at the hospitals, they are also measuring, like episodic readings through different devices, such as, like blood pressure cuffs, SpO2 monitor, scale, glucometer, and so on. So all of these devices typically are Bluetooth enabled. And since they're Bluetooth enabled and our device is also Bluetooth enabled, we can integrate all of those readings, these episodic readings from these third-party devices into our platform. And now, after integrating all of that, we can provide a holistic overview of a patient's health to their healthcare providers. We have also done integrations, EHR integrations with point-click care. We are working on integration with ERD by the end of this year or early next year. They're also working on Epic integration as well. Okay, so what does the functionality of this platform looks like? So three broad categories here. Real-time emergencies, that is the fall detection, whether a person is wandering, if they have left their safe zone, we can identify that. And once we have identified that, we send real-time emergencies to their care providers. Then the help button, I talked about that, the emergency button that the patient can press. And the second is around clinical insights. As I said, we collect data 24/7, so you can do trending analysis on that data, whether a person has had insufficient sleep, dehydration, irregularities in their activities of daily living, then nighttime walking. And here are some charts and graphs that show as to what is it that we collect and how is it that we display that to their caretakers. Then the final thing, the third thing, is the predictive analytics, which I talked about, the UTI risk, the fall risk, pressure injury risk. Uh, yeah, so you may ask as to why is it that we decided to build our own purpose-built smart band rather than just using some of the smart bands, smart watches that are commercially available. In fact, we started with working with these commercially available smart bands. But one of the things that we realized is that the battery life on those commercially available smart bands isn't that great. They either last half a day, maybe max 1.5 day. Uh, but the use cases that we are going after, that is senior folks at nursing home facilities or at rehab centers, um, they they cannot be expected to charge their smart bands every day or every other day. So we needed to have a battery life that lasts for at least 4 to 6 days or so. And that's one of the reasons why we decided to build our own smart band, which is really simple smart band, no frills, no additional capabilities other than just um, calibrating the different gestures using various sensors such as accelerometer, gyroscope. And also, we wanted to make sure that like this device is waterproof, is really light, simple to use, simple user interface, and that's the reason why we decided to build our own purpose-built smart band. Okay, so just quickly reiterating, what are the unique things that we do with our platform and solution? Is that like we have a bunch of data algorithms based upon the data that we collect across a patient and the data that we have already collected. In fact, our company was founded in 2015, and we didn't commercialize a product till about a year and a half or almost 2 years ago. And the reason for that was that we wanted to collect a whole lot of data across so that we can, the predictive analytics that we provide is really strong. The sensitivity and specificity on the data, on the algorithms is really high because we are going to be using this in a clinical setting, in hospitals and nursing home facilities. So we wanted to make sure that the accuracy on the insights that we provide based on the machine learning algorithms is really high. And that's one of the reasons why we took such a long time in order to do pilots and POCs with these hospitals, with these nursing facilities, to make sure that the data that we are collecting can provide um, clinical insights that can be used in real life settings in these hospitals and nursing home facilities. Then, as I said, we don't need any external sensors, just the smart band, which connects to your phone through BLE and then to the cloud. Then you push the data into the cloud. It works anywhere, indoors, outdoors. We use novel, patented, gesture-based detection technology. It's completely passive. And as I said, we have done integrations with EHRs. And then it also facilitates family engagement. Now, just imagine in like today's environment or last year when like with COVID and with people not being able to meet their families who may reside in the same state, same city, or they might be um, separated from from coast to coast, right? So how is it that you can have that peace of mind that your family member is doing well, right? So therefore, like we have built these caretaker apps, family user apps, so that you can monitor. You can not only get that peace of mind, but also monitor as to how is my dad, how is my mom doing, by just looking at the stuff. Oh yeah, you know what? I can see the number of steps, the amount of sleep that they had, uh, the amount of liquid that they intake, so that that can provide them some relief in terms of how their loved one is doing. And here's a little bit about the financial case of SafeBeing is that, like here, the key points I want to make is that you can use CPT reimbursement codes for remote patient monitoring. So that's something that we have seen with the healthcare providers has really resonated well in terms of the adoption of this technology. So SafeBeing enhances basically both the top line and the bottom line growth. And here are the 4 or 5 CPT reimbursement codes that I have seen, healthcare providers use. Just I think, I believe a couple of years ago, there used to be a single bundled CPT code, but now they have unbundled those CPT codes, and now you can get use those CPT reimbursement codes, and this has helped reduce some friction in the adoption of our remote patient monitoring technology. So let me give a quick demo of the product. So here I'm wearing our smart band, and I'm gonna take a couple of sips of water and coffee, and then I'll show that sort of a small red light will go off on this band, which will indicate that the gesture of drinking was detected by the smart band. So this demo just gives sort of showcases a slice of what this platform does. So let me pick a cup of coffee here in my hand, and then I'll take a sip, and then I'll show that the red light goes off here. So I'm not sure if you saw this or not, but let me take a sip again. So now let me give a demo with just taking a sip of water. So you saw that the red light went off and it vibrated as well. So what that indicates is that we detected the gesture, the motion of drinking. Now in the back end, once we have recorded that, then based upon sort of how long did I take that sip, in the back end now it's going to calibrate as to, okay, what is the conversion of that sip to milliliters? And then over a period of their day, we can identify as to how many cups of liquid did the person take, and the conversion of cups to milliliters. So you can imagine, as I said, you can identify the irregularities in the drinking pattern of a patient, whether this person, like whether the patient is at a risk of dehydration or not. Okay, so I talked about the why, then we talked about the what in terms of what is it that we have built. And now maybe I'll give a little bit of a color around how is it that we do this. So here's sort of a high level picture of the architecture of SafeBeing. Here on the left hand side, you can see the elderly patient who has the app, the smart band. Then we collect data 24/7 using those wearables, using those smart band, and all of that data is pushed to the cloud, where we do our analytics. We provide alerts and insights. We also integrate with EHR applications, point-click care, and as I said, like Yardi and Epic are coming soon. And then we also provide a dashboard that the caretakers, the physicians, the nurses can use, not necessarily to dig deeper into the data, but if they want to and look at the pattern and the trends, they can do that. They don't need to have any data analytics or predictive analytics knowledge. This is just so that if they want to dig deeper into a patient and see and identify and see the trends and patterns, they can do that using the dashboard by looking at the graphs and charts and the data that we have collected. But sort of the main goal of the web-based dashboard is so that they can take a look at the reminders, the alerts, the notifications, so that they can take proactive actions in terms of improving the patient's care and provide them with better care. And then lastly, on the right-hand side, you see the family member. So, like we have these family member apps, caretaker apps, so that they can monitor um, how their loved one is doing, whether at a nursing facility or whether they are living independently or so, so that they can have the peace of mind. And here's sort of the internals of our smart band. As I said, it's a simple smart band with one emergency button. That's the only active aspect of the smart band, that the patient, if they need help, they can press the emergency button, and that can trigger alert and notification to their caretaker. And then it has simple 3 LEDs, a vibrator, so that like you can as they press the emergency, they can feel the vibration as well. Yeah, it has a long battery life. As I said, like we want to make sure that the battery lasts for about 4 to 6 days. And here's a chart that showcases how is it that we detect the drinking. As I said, that there are 2 sensors, accelerometer and gyroscope, on these smart bands. And then here you can see that on the top chart, it showcases the hand to mouth gesture. Like for drinking, it can be divvied up into 3 actions. One is the hand to the mouth gesture, then taking the sip, that's the second one, and then hand away from the mouth. So that's the third. Then these patterns, these sequences detect that, okay, a drinking event happened. And how does this reading look on data that's collected from accelerometer and gyroscope? And then this is something that we feed to our machine learning algorithm so that they identify the drinking pattern. So whenever we do any hand gestures, it goes back, looks into the data that we have collected, and then says, oh yes, I identified a drinking pattern. Now let me quantify the liquid intake. So similarly, this is how we calibrate medication intake. Hand to mouth, pill to mouth, then hand from the mouth. So that's the sequence of medication intake gesture detection across both the accelerometer and the gyroscope. Okay, and from a security perspective, we are HIPAA compliant, GDPR compliant. We do extensive penetration tests to make sure that we address all of the potential security vulnerabilities that may come up as we release our new versions of our AI-powered platform. Okay, so now we talked about the motivation behind building a remote patient monitoring platform. Then we talked about the why aspect of that. We talked about the what, the how. Now, okay, so what? right? So show me the data as to that. Okay, does this really work, right? Um, so we did a third-party study with Holy Family Senior Living for a period of about 3 months, and we also had like one of our strategic advisors who is a marketing professor at the Wharton School to help us with this research, so that it wasn't something that we were saying, but it was something that third parties looking at the data and coming up with the conclusions. So this is a study that we did over a period of 6 months. So we showed that with the adoption of Somatix's SafeBeing platform, we were able to improve the overall quality metrics by about 49%. We were able to reduce the 30-day readmissions by 17%. Fall reduction, we saw a decrease of about 42%. UTI reductions by about 52%. So one of the big things for us was that we wanted to make sure that the adoption and adherence of the smart band by our patients, by our users, is really high, so that we can collect the data 24/7. If half of the day the patients are not wearing the band, that's not good, because we cannot, then we are missing out the data for half of the day, right? So therefore, for us, the engagement metrics, the adoption and adherence were really important for us. And we saw that we are able to hit adoption by about greater than 80%, adherence by about 90%. So that shows that, in fact, we also had 3 iterations of the smart band, making sure that the material is soft enough. It doesn't leave marks on the patient's hands, because as you age, your skin gets a little softer, and then it leaves some marks. So we wanted to make sure that it is really comfortable for the patients, especially the senior population, to wear these smart bands, so that we can collect the data passively 24/7. And then we also saw that, like initially we thought that the caretakers may have some inhibitions in terms of adopting uh, these advanced technological solutions. Whether is that going to increase their time to make sure that the patient is wearing the band and so. But on the contrary, we saw that um, it did not increase the time pressure for them. In fact, if anything, it increased the empathy that they had for their patients. So that was a great finding for us, to see that it improved the quality of work for these caretakers. So finally, I would like to summarize by saying that uh, remote patient monitoring is a very powerful tool to provide unique insights in the forms of real-time alerts, notifications, clinical insights, and predictive analytics, such as, as I showed, UTI risk analysis, fall risk analysis, that can truly enable to improve the quality of care that caretakers can provide to a patient. And also, we would like to see that going forward, how is it that we can not only provide the clinical insights, but also improve the health outcomes for these patients. And just in the last slide, like I showed that we conducted some studies to showcase that these passive remote patient monitoring solutions truly work, right? So we feel like we have built a unique AI-powered gesture detection platform using wearables, without the need of any external hardware, sensors, cameras, beamers, and so on. So I think the need for remote patient monitoring has even become greater due to today's COVID-related constraints, where there is a drastic shortage of caretakers, nurses, physicians. So how is it that technology can address some of these challenges? We know that the healthcare providers are the heroes. How is it that we can further enable them to take better care of their patients. And I truly feel that a passive remote patient monitoring solution can be a unique solution to address some of these challenges that we are facing today. So I would like to thank everyone for giving me an opportunity to talk a little bit about remote patient monitoring. And if you would like to get more information, please feel free to contact me via email, through LinkedIn, or through Twitter. So thanks for your time. I appreciate it.